We are going to demonstrate today some different soft tissue reconstruction graft suturing techniques for various applications, collateral ligament reconstruction, patellofemoral, you name it. And we want to demonstrate this with some new suture options that are available. What we've got up here is we have a 1.3 millimeter SutureTape fiber loop in blue white or black white, as well as a 0.9 millimeter SutureTape fiber loop in blue white. The first technique that I want to show is the speed whip technique, and I'm going to use the 0.9 millimeter SutureTape fiber loop. And this is a very good technique for patellofemoral graft preparation. When you have a small-ended graft, it's low profile, it doesn't mummify the tissue, and does not add extra bulk to your graft. Here's the technique. I'm going to take the looped end of the suture, bring it over the graft, and then as far as length, anywhere from 1.5 to 2 centimeters will be good for a patellofemoral graft. That's about the length that's going to go into a patellar socket, for example. So, and this is going to be probably 4 or 5 throws. So pass the needle down through, pull it tight, and then just repeat. Bring this back, pass it a little bit off center so it's not in the same tissue plane as the previous throw. One more pass, kind of like right here towards the end. Pull this in, and then if we want to, we can do like a little locking stitch, and where we can pass just behind this last stitch to kind of almost create like a little Mason Allen type ripstop. And so now you can see we have a very low profile speed whip on the end of this graft. In fact, it's so low profile you can hardly even see the suture. So you've got plenty of collagen to heal into a socket, into a bone socket here. And then if need be, you can always bulletize this end a little bit more, but this as is should be great to fit into a reconstruction socket. So what we have now is we have several different options here that we want to go over for a single-stranded graft prep for a locking crack out or a baseball stitch, etc. So we have several different 1.3 millimeter SutureTape options here. We have these diamond point needles of varying size here and here. We have different curved needles, also as you can see, of varying size, as well as 0.9 millimeter SutureTape single strands with 2 needles on the end. One thing to point out here is this new color here. This is a new product with black and white colors to it. This is really good. It stands out in a complex surgical field to be easily identified. So the first thing we're going to demonstrate with this straight diamond tip needle is going to be a double-limbed locking crack out. So we're going to start here, and we're going to pass each limb from this point out to the end. We can start, do about 2 to 2.5 centimeters here. We can place one end and just kind of even them out like that. Pass one off to the side. And then through. And then just as you would, create a lock like so. You can see these diamond tip needles are really sharp, and they just really pass through the tissue very, very easily. And you can use this with a needle driver. If you're comfortable, you can use your hand. That is one of the advantages of these straight needles. And if you want to, we can do this in a minute, but I can leave that for there. If we want to, we can also, like, again, kind of come back through it and create like one last lock, but that's optional. And then we'll just do the other side. And if you want to, you can see how I kind of grabbed almost on the other side, almost into this path a little bit, just to get some extra overlap of the sutures, make the construct a little bit stronger, like that. And you can take this as is, just like that. You can see that has really good hold of the tissue. It's low profile. You still have a lot of exposed collagen. It's not bulky because of the tape. And then again, if I want to, I can do one last pass sort of out through the end, or I can take it just as it is, just like this. And we can accomplish the same thing with a single needle suture here. So this is another 1.3 millimeter SutureTape with a needle just on one end. And we can do a locking crack out, but the difference with the single needle is we'll start distally, work up, come over, and then come back down. And obviously I'm going to use curved needle driver. Bring it through, get it roughly even, go up a couple centimeters. Again, just make sure to always lock it. can kind of shimmy the loops down so that they're tight on the tissue. And kind of work it back and forth like that. We'll do this one last pass on this side. Bring it across. And then we'll work it back down the other side in similar fashion. Probably easier to go from top down as opposed to bottom up on this side. And work it back and forth. And you can see how nice that suture tape lays against the tissue. It doesn't add any bulk to it. It reinforces it nicely. And again, it really stands out. You can see how well this color stands out against the collagen. And again, it makes it just very identifiable. So if you've got a bloody surgical field, you're not going to lose sight of this suture or anything that it's attached to. So now we have a single needle running, locking Krakow stitch, very well reinforced, low profile suture, lots of exposed collagen. And again, the contrast there between the suture and the soft tissue graft is very, very evident and very helpful for those complex surgical fields.